Hi, friends. I'm Dr. Sai Viksheth Raj, consultant spine surgeon at Narayana RN Tagore Hospital, Mukundapur. Today, I'll be discussing some of the common questions that I get from all my patients in my OPD. So that's a good question actually. So especially pain in your back, which radiates to your lower limb, especially while sitting or lying down, means that there is some compression on the nerve. It means that the nerve is getting pinched. It can be either due to a slipped disc or a slipped bone. So when you present with such complaints, we usually recommend an X-ray or an MRI. Before that, we examine you clinically. We see how severe the complaints are, and based on that, we can take a call. So, especially if these symptoms are very severe, like let's say there is some involvement of your bowel or bladder, like if you're repeatedly urinating, or there's loss of control in your urination, then it becomes an emergency, and you need to visit your doctor as soon as possible. It's a very good question when you asked. So, if there's a neck stiffness which radiates to the upper limb and there's numbness in your fingers, it means that there is a compression on your spinal cord in your neck. So it's very important to assess how it is, especially in elderly, if they're having difficulty with buttoning their shirts or difficulty in eating or holding some objects. And also if there is difficulty when walking or if there's loss of balance, then it means it's an alarming sign, which means that the compression is quite severe in your spinal cord, especially at the level of the neck. And it is necessary to get an MRI done and to see the severity, and we should start on medication as per the severity. It's often asked in OPD, if there's a disc bulge, do we need to go for a surgery? Not necessarily. See, 80% of time, a disc bulge can be treated without any surgery, without any surgery or any procedure also, just with medicines, physiotherapy, and lifestyle modifications. Disc bulge can be treated with that. So again, another 15% can just be treated with an OPD-based procedures like steroid injections into the back, like what we call a selective nerve root block. Only 5% of disc bulges will require a surgery. That surgery nowadays, it's a microscopic and endoscopic surgeries, so which are daycare surgeries, which means that you get admitted early in the morning and get discharged by evening. So the recovery is quite fast. The recovery rate and your return to work is much more faster. It's hardly in a week you go back to your work and to your daily routine is normal. So thanks for sharing this. Uh, so especially the thing you're having, if you're having numbness in both your lower limbs, especially while walking, which is associated with back pain, so it is due to the spinal canal stenosis. That's what we call, because there is a compression of your total spinal canal. It is especially seen in elderly. So there will be numbness and there will be weakness in the limbs. They won't be able to walk for long duration. So once you start walking for 2 to 3 minutes, you'll start feeling the pain in your limbs, and then you need to sit down, take a rest for a while, and then get up and walk. So if this distance keep decreasing, it becomes progressive. The distance keep decreasing as years go by. So that is when you need to get an MRI, see what can be done. So again, this can be 80 to 85% of the times it can just be treated either with uh, medicines, physiotherapy, lifestyle modification, or a selective nerve root block of a steroid injection. Only 10% of times you might be needing a microscopic surgery to treat the cause, and then the recovery is much quite easy following a microscopic surgery, and it's much more faster and much more advanced than what it was previously done. So hopefully I have answered all your questions. But if you have any more questions, please leave them in the comment box. We'll try get back to you as soon as possible. Thank you.